My dear friends, as we get older, it can feel overwhelming when every doctor visit comes with another test, another scan, or another screening you're expected to agree to. And many seniors tell me they feel pressured to say yes, even when they aren't sure those tests still make sense for their age or health. In this video, we're going to talk honestly about 5 medical tests that many adults over 70 have the right to question, delay, or even refuse. Not because these tests are bad, but because the risks and benefits change as we age, and your comfort, safety, and quality of life matter more than ever. My goal today is simple: to help you understand when these tests are helpful, when they may cause more harm than good, and how to confidently talk with your doctor without feeling guilty or scared. You deserve clear information, not pressure. You deserve choices, not fear. And you deserve a voice in every decision made about your own body. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. It helps us feel like one community here, learning together and supporting one another. And if you have any natural health tips of your own, feel free to share those too. Someone else might really benefit from hearing what's worked for you. Point 1. Why medical screening changes after 70. My dear friends, one thing many older adults in the USA don't realize is that medical screening tests are designed with age, health, and life expectancy in mind. What was helpful and necessary in your 50s or 60s may not provide the same benefit once you pass 70. In fact, the balance between benefit and harm shifts more than most people are ever told. And that shift is not your fault, it is simply the way aging changes the body. After 70, your health needs become more personal and more complex. Your body handles sedation differently, recovery takes longer, and even simple procedures can create complications like dehydration, dizziness, confusion, or unexpected hospital visits. At the same time, many cancers and conditions grow much more slowly in older adults, meaning you may never experience symptoms from them in your lifetime. This is why continuing every single test, just because you've always done it, may not be the safest choice anymore. The goal of medicine after 70 is not to chase every tiny problem. It is to protect your comfort, your independence, and your quality of life. Screening should support you, not scare you, overwhelm you, or put you at unnecessary risk. That's why understanding how screening changes with age is the first step toward wiser, more confident decisions about your health. Point 2. Colonoscopy. My dear friends, colonoscopy is one of the most common tests doctors order, and for many years it has saved lives. But once you reach your 70s, the picture changes in ways most seniors are never told. If you've had regular colonoscopies throughout your life and they were always normal, your risk of developing a dangerous colon cancer in the next 10 years becomes very low. Meanwhile, the risks of the procedure itself rise sharply with age. This is why many experts now say seniors have every right to question whether another colonoscopy is truly needed. The preparation alone can be hard on an older body. The strong laxatives can cause dehydration, weakness, dizziness, and even falls. Seniors with heart disease, kidney problems, or diabetes are especially sensitive to these shifts. Then comes the sedation, which can cause confusion, low blood pressure, and slow recovery. And while rare, risks like bleeding or perforation are more likely at older ages. On top of that, even finding a harmless little polyp can trigger a cycle of repeat procedures you may not need. But colonoscopy still has a place for some older adults. If you've never been screened before, have a strong family history, had polyps in the past, or are now experiencing symptoms like blood in your stool or sudden changes in bowel habits, the test may still protect you. The key is not to say yes automatically, but to ask your doctor what your actual risk is and whether the benefit truly outweighs the risk for your age and health. Point 3. Mammograms after 70. My dear friends, mammograms are one of the most emotionally charged tests for older women. For decades, you've heard one message over and over: early detection saves lives. And that message is true, for women in their 40s, 50s, and early 60s. But after 70, the way breast cancer behaves changes, and the way these tests affect your health also changes. This is the part most seniors in the USA are never told unless they ask. As you age, your breast tissue becomes more likely to create false alarms. A mammogram may show something suspicious that turns out to be completely harmless. But once that alarm sounds, you're sent for more imaging, more appointments, and sometimes even a biopsy, a procedure that is painful, stressful, and not without risk. Many older women describe these follow-ups as weeks of anxiety, sleepless nights, and fear, all for something that never would have harmed them. Another issue is overdiagnosis. Some breast cancers grow so slowly in seniors that they would never cause symptoms or shorten your life. But once they're found, the pressure to treat them is strong. That treatment, surgery, radiation, hormone therapy, often brings side effects that can affect your comfort, mobility, strength, and daily life far more than the cancer ever would have. So when does a mammogram still make sense after 70? If you're in excellent health, active, and likely to live 10 to 15 more years, continuing may be reasonable. But if you're struggling with multiple health conditions, limited mobility, or simply want to avoid unnecessary stress, stopping routine mammograms becomes a thoughtful and medically supported choice. A good question to ask your doctor is, given my age and health, am I more likely to be helped by this test, or harmed by unnecessary follow-ups? That one question can change the entire direction of your care. Point 4. PSA testing for prostate cancer. My dear friends, many older men in the USA are still getting yearly PSA blood tests without anyone explaining the full picture. PSA screening sounds simple, but what happens after the test often becomes a long, stressful journey that may not improve your health at all, especially after age 70. The first thing to understand is that the PSA number can go up for many harmless reasons: an enlarged prostate, a mild infection, or even recent activity. But when that number comes back high, it sets off a chain reaction that can be far more harmful than the original concern. You may be sent for a biopsy, a procedure that can cause infection, bleeding, and days of discomfort. And if the biopsy finds a very slow-growing cancer, which is extremely common in men over 70, you may suddenly feel pressured into surgery, radiation, or hormone therapy. Here's the hard truth most men never hear. Many prostate cancers found in older men would never cause symptoms or shorten life. They grow so slowly that you would pass away with them, not because of them. But once a doctor finds them, the pressure to do something often leads to treatments that bring very real side effects: incontinence, impotence, bowel changes, weakness, fatigue, and emotional distress. These side effects can dramatically affect your quality of life. So when does PSA testing make sense after 70? It may still be helpful if you are very healthy, have a strong family history of aggressive prostate cancer, or are experiencing new urinary symptoms that concern you. But for most older men, routine yearly PSA screening is not recommended by major medical organizations. A powerful question to ask your doctor is, if my PSA is elevated, what happens next, and will those next steps actually improve my life? That one question can save you from unnecessary stress, procedures, and suffering. Point 5. MRIs and CT scans for back pain. My dear friends, back pain is incredibly common after 70. It's part of normal aging: arthritis, muscle stiffness, old injuries, and simple wear and tear. But here's what many seniors are never told: an MRI or CT scan for ordinary back pain often does not help you feel better. In fact, for many older adults, these scans can lead to unnecessary worry, additional procedures, and treatments you may not need. Here's why. These imaging tests are very sensitive, and they almost always find something: bulging discs, arthritis, narrowing of the spine, bone spurs, or degenerative changes. But these findings are usually part of normal aging, not the cause of your pain. Thousands of seniors have the same abnormalities, even when they feel perfectly fine. But once you see them on a scan, it's easy to believe something is seriously wrong. That fear often pushes people toward surgeries, injections, nerve blocks, or long lists of specialist visits. And those procedures come with risks, side effects, and little guarantee of relief. Many seniors regret going down that road, especially when their original pain might have improved naturally with gentle movement, physical therapy, stretching, or time. So when should you get an MRI or CT scan for back pain? Only when red flag symptoms are present: sudden weakness in your legs, loss of bladder or bowel control, severe worsening pain, unexplained weight loss, or a history of cancer. In those cases, imaging can save your life. But for everyday back pain from gardening, walking, or sleeping the wrong way, an MRI is usually unnecessary. A helpful question to ask your doctor is: will this scan actually change my treatment, or will it simply show age-related changes that don't need fixing? Point 6. Whole-body CT scans and lung scans. My dear friends, many seniors are being offered full-body CT scans or low-dose lung scans as a way to catch everything early. It sounds reassuring, like a simple scan could give you peace of mind. But for adults over 70, these scans often create far more stress, follow-up tests, and unnecessary treatments than real benefits. Here's the part most older adults are never told. Whole-body scans find lots of things that look abnormal but are completely harmless. Tiny lung nodules, cysts on the kidneys, spots on the liver, almost every senior has them. These are called incidental findings. They would never cause symptoms or shorten your life. Yet once a scan finds them, you end up in a cycle of repeat scans, specialist appointments, biopsies, and weeks of worry. All for something that didn't need treatment in the first place. These scans also expose you to radiation, which adds its own risks, especially when done repeatedly. And for seniors who never smoked or don't have major risk factors, the chance of finding a dangerous lung cancer is extremely low. This is why experts strongly advise against routine whole-body CT scans for peace of mind. Now, when do these tests make sense? A low-dose lung CT may be appropriate if you're between 55 and 80, have a long smoking history, or quit within the last 15 years. But if you never smoked, or your doctor suggests a full-body scan, just to be safe, you have every right to question whether it's necessary. A powerful question to ask your doctor is: if this scan finds something small, will it lead to tests and treatments that may not help me or improve my life? Point 7. When you should never delay or refuse a test after 70. My dear friends, while many routine screening tests may no longer be necessary after age 70, there are moments when you must act quickly and get evaluated right away. This part is important, because your safety always comes first. Screening tests are for people who feel fine. But diagnostic tests, tests done because you have symptoms, are a completely different matter. These should never be ignored. Certain symptoms in older adults require immediate testing, even if you normally avoid extra procedures. If you experience unexplained weight loss, new or persistent blood in your stool or urine, a new lump anywhere, for example. What are we looking for with this test? How will the results change my treatment or day-to-day life? What are the risks of the test, especially for someone my age? Are there safer or less invasive options we can try first? These questions shift the conversation from pressure to partnership. They remind your doctor that you're not a passive patient, you're an active participant in your own care. Point 9. You have the right to make your own medical decisions after 70. My dear friends, one of the most important truths about aging is this: you are still in charge of your body and your choices. Too often, older adults begin to feel like passengers in the healthcare system. Tests get ordered, medications get added, procedures get recommended, and many seniors feel they must simply say yes, even when something deep inside them feels unsure. But after 70, personal autonomy becomes more important than ever. You've spent your entire life making decisions, raising families, building careers, overcoming hardships, and guiding others. That wisdom does not disappear with age. You know your body better than anyone else. You know what you can tolerate, what gives you peace, and what steals your comfort. And your medical care should honor that knowledge, not push it aside. Modern geriatric medicine follows a powerful principle: less is often more. This means fewer unnecessary tests, fewer medications, fewer risky procedures, and more focus on comfort, stability, independence, and joy. Research shows that seniors who avoid low-value tests and treatments often have fewer hospitalizations, fewer side effects, and a better quality of life overall. In other words, saying no at the right time can actually help you stay healthier. This doesn't mean ignoring medical advice. It means having choices. It means asking questions until you are satisfied. It means weighing risks and benefits based on your age, health, and personal values. And it means recognizing that a test that helps one senior may not help another. You are not irresponsible for questioning a test. You are not stubborn for wanting peace instead of pressure. You are not difficult for protecting your comfort and dignity. Point 10. Better, safer alternatives that give you peace of mind without the risks. My dear friends, one of the biggest worries seniors share with me is this: if I stop these big tests, how will I know I'm still safe? That fear is completely understandable. You've spent decades being told that screening is the best way to protect your health. But after 70, protection looks different, and thankfully, there are gentle, simple, and safer alternatives that give you reassurance without putting your body through stress, sedation, or unnecessary procedures. For colon health, you don't always need another colonoscopy. If your past tests were normal, stool-based tests like FIT or Cologuard can give valuable information from the comfort of your home. No prep. No sedation. Just a simple sample you mail in. These tests detect small changes that deserve attention, without the risks that come with invasive procedures. For breast health, even if you stop routine mammograms, you are not ignoring your body. You can still perform gentle self-checks, stay aware of how your breasts normally feel, and alert your doctor if you notice a lump, pain that doesn't go away, dimpling, or other changes. This kind of attentive self-care has helped countless older women stay safe without the anxiety of constant imaging. For prostate concerns, instead of rushing into PSA screening, focus on what your body is telling you. Changes in urination, new discomfort, or unusual symptoms are far more meaningful than a fluctuating PSA number. Your doctor can guide you based on symptoms, not just lab values. And for back pain, the most effective alternatives are the simplest. Light stretching, walking, gentle strengthening, warm compresses, and physical therapy often work better than expensive scans. These methods help your body move again without dragging you into a chain of procedures that may not help. These alternatives are not second best, they are smarter choices tailored to the needs of seniors. They reduce risk, reduce stress, and help you focus on what truly matters: staying independent, comfortable, and confident. Your goal now is not to chase every possible problem before it exists. Your goal is to support your body wisely, listen to your symptoms, and choose peace over pressure. Point 11. A simple 7-day reflection plan to help you make confident medical decisions. My dear friends, information only becomes powerful when you take a moment to reflect on it. Many older adults feel overwhelmed after hearing about medical tests, risks, and options. That's perfectly normal. Decision-making after 70 should be slow, thoughtful, and gentle, not rushed or pressured. This simple 7-day reflection plan is designed to help you understand your own needs, prepare for your next doctor visit, and feel confident speaking up. It takes only a few minutes each day but can completely change how you approach your healthcare. Day 1. Write down all the medical tests you've been getting regularly: colonoscopy, mammogram, PSA, MRIs, blood tests, anything. Day 2. For each test, note when you last had it and what the result was. Ask yourself, did it change anything in my care? Day 3. Reflect on your feelings. Did the test give you peace of mind, or did it bring anxiety, discomfort, or more procedures? Day 4. Think about your health goals. What matters most to you now: comfort, mobility, independence, fewer appointments, or peace of mind. Day 5. Write down 3 important questions you want to ask your doctor at your next visit. Use the questions we discussed earlier. Point 12. Guidance for family members and caregivers, how to support without taking over. My dear friends, many seniors in the USA tell me that one of their biggest fears is losing control over their own medical decisions. At the same time, many adult children and caregivers feel anxious too. They want to protect you, but sometimes they don't know how to help without pushing too hard. This creates tension that nobody talks about. That's why this part of the conversation is so important. Your family can support you, but your voice must always remain at the center. If you are a family member or caregiver listening to this, here is what your loved one needs from you: support, not control. They need you to stand beside them, not in front of them. Let them lead the conversation. Their body, their values, and their comfort should guide every decision. You can help by asking gentle questions instead of making demands. For example, instead of saying, "You have to get this test," try asking, "How do you feel about doing this? What worries you the most? What matters most to you right now?" These questions open the door to honest discussion instead of fear or pressure. Attending appointments together can be incredibly helpful, not to take charge, but to listen, write things down, and make sure your loved one isn't rushed or dismissed. Sometimes, just having another person in the room helps slow the conversation down and reminds the doctor that shared decision-making is essential. Ask clarifying questions like, "How would this test change their care?" or, "Are there gentler alternatives given their age?" These questions protect your loved one while keeping them in full control. If you are the senior in this situation, remember this: your family loves you, but your choices matter most. You have the right to speak up if something doesn't feel right, and you have the right to say, "I appreciate your help, but this decision is mine." And if you're a caregiver, the most compassionate thing you can do is honor that statement. Medical decisions after 70 are not just medical, they are emotional, personal, and tied deeply to the life a person wants to live. When families work together with respect, honesty, and patience, the outcome is always better for everyone. My dear friends, we've covered a lot today, and I want you to take a deep breath and let this truth settle gently in your heart. You are allowed to make medical decisions that protect your comfort, your dignity, and your quality of life. Growing older does not take away your voice. If anything, it strengthens it. You've lived through more than most people will ever understand. You have earned the right to choose what feels right for your body and your future. Screening tests are tools, not obligations. After 70, the goal is no longer to chase every tiny possible problem. The goal is to live well, to stay steady on your feet, to protect your independence, and to spend your time on what brings you joy, not what fills your calendar with appointments, procedures, and worry. Some of the healthiest and happiest seniors I know aren't the ones who do the most tests. They're the ones who choose wisely, ask questions, focus on their symptoms, and only pursue care that truly improves their life. Before you go, I want to leave you with one very personal question, and I hope you'll answer it in the comments. What is one medical decision or test you want to feel more confident about from now on? Your answer might give courage to someone else your age who is afraid to speak up. If this message brought you clarity, reassurance, or strength, please like the video and subscribe. You're not just supporting a channel, you're joining a community of seniors who want to age with wisdom, dignity, and peace. Share this video with someone you love who may be struggling with these choices. You might give them the confidence they've been missing. Thank you for spending this time with me. Stay informed, stay gentle with yourself, and remember, your health decisions belong to you.